Hi there, everyone. Welcome to the Michigan HIV/AIDS Council YouTube channel. We are covering another organization in our wonderful Spotlight series for this year, and we're bringing it to an organization that really cares about people impacted by HIV and hopefully is contributing to ending the HIV epidemic. My name is Evan Hall, the youth liaison of the Michigan HIV/AIDS Council, and I am just super excited to be with our wonderful CARES colleagues here. So please go ahead and introduce yourself.
Hi, my name is Love Chambers. I'm a registered nurse and a nationally certified tobacco treatment professional. My job at CARES is primarily tobacco treatment to help people reduce and quit smoking. I also serve as a medical case manager.
Hi, I'm Roger. I'm the clinical case manager in the Benton Harbor area. I help clients with getting started and getting a provider in check, and that's about it. More to that.
Hello, my name is Nick Foster. I'm a non-medical case manager for CARES out of our Benton Harbor office.
Good afternoon. My name is Jose Calderon. I am the HIV/STI Prevention Director here at CARES. I oversee HIV and STI testing here as well as home testing. We also help consultations with PrEP to help prevent people getting HIV.
Hello, my name is Beth Hare Lewis. I am on the Community Engagement Committee at the Michigan HIV/AIDS Council, and I also work at CARES as the HOH Program Manager, which is hypertension, obesity, and did I say it right? Here's one more. We call it our Veg and Sweat program, where we actually we have instructors that offer cooking classes, nutrition classes, mindfulness classes, stretch and fit classes, and a walking program. I also am responsible for the Healthy Relationship Group that we serve as a support group, and all this is done virtually at this time.
Hi, I'm Pat Clark. I'm the Director of Housing. I've been with CARES many, many years in many, many roles.
Well, thank you everyone for that wonderful introduction there. And let's just dive into one of the key questions people always ask our organizations is, what are the key populations your organization serves? And of course, anyone can take this one.
Okay, well, I'll go with it. And so we serve several different people. Of course, people living with HIV and AIDS are most of the people that we serve. Actually, that's all the people that we serve. Besides our prevention side, when we have people coming in to get tested to make sure, with the HIV and STIs, and we do a full range of tests. We also serve Black, Indigenous, and all people of color, immigrants, including undocumented individuals, and of course our LGBTQ community, at risk and underserved individuals, including people that are living in poverty, people who are homeless, people dealing with mental health and substance abuse issues.
Thank you, Beth. That is wonderful and great to hear. Now, in terms of how each of your roles engage these key stakeholders of your organizations, could you each go around and describe how you engage the community stakeholders and the people you serve?
I'm happy to start with that one. We come from an approach of unconditional positive regard for our clients, which means that we meet people where they at. We respect people's insight, knowledge, and understanding of themselves. We believe and support that our clients are the experts in themselves and what they need. And so we really take on a supporting role. A lot of times we see our role as removing barriers and helping people get things out of their way so they can, live the life they want to.
And in the housing world, we work on housing goals where we're trying to make positive forward progress for someone so that they can achieve sustainability in their housing, and that way We utilize motivational interviewing and, as Love said, that positive regard. And we have a lot of cultural humility that we work on.
On the prevention side of things, we focus on hiring people within our communities, the communities that we want to reach out. So we try to hire people in the LGBT community, trans population, people of color, so we can reach those populations that are underserved. And we also meet people where they are by going to camps. Like, for example, around here, we have the Dunes and Campit Resorts, which are focused mostly on LGBT population. We do testing there. We do testing amongst homeless communities. And that's how we reach our focus there. We reach our goals through that.
On the clinical side of things, we work on getting clients into a provider, an HIV provider, to make sure that they have the medications that they need, and that they get their labs in and help them with any costs that may be involved with their HIV care.
And I would just echo everything that everyone else has already said. Really just important to let people tell you what they need and do our best to connect them to those resources.
And I just want to add, with the HOH program, one thing that I think that we all are proud of is that we want to treat the whole person and not just their HIV status. So offering these programs like nutrition and cooking, even the smoking cessation and the mindfulness class, it's helping our individuals look outside of that. They're just all about, am I taking my treatment? So they're getting a chance to do exercises and to work on their mental health. And we really treat people, the way they want to be treated. We let them guide us through that, but we offer it to them and just try to be a really supportive team by helping them know that there's other things out there that we also can do, like work out all together, doing stretch and fitnesses and learning how to cook healthy. And we have really wonderful instructors that come on virtually for us. And it's a very supportive environment.
Well, I think that leads us into a great segue, diving into not necessarily the services that CARES provides, but the mission and values. So can you each talk about how your mission and values of the organization align with ending the HIV epidemic?
We recently kind of revamped our mission. The mission previously only addressed, ending HIV and supporting people who are infected or affected by HIV. We're expanding our world, so to speak, by looking at sexual health and wellness, kind of like what Beth said, the whole person. And in the work that we're doing around HIV and ending HIV, you have to be able to address STIs, looking at primary care, getting sexual health and a sexual health history. It's so much more comprehensive than just the HIV. And so we've expanded and are looking to be the whole person, but especially this sexual health part of there.
So one thing we really focus on here at CARES as well is what's known as trauma-informed care. So recognizing that very, very many of the folks we serve have experienced trauma, whether it's through adverse childhood events, also trauma is adults. We talked a little bit earlier about the at-risk populations. There's so many groups who are disadvantaged because of, kind of social constructs in our society. And so addressing those needs and treating the whole person, right? Coming with the holistic approach that we use. Because for folks living with HIV, that's one piece of their life, but we try to look at all these other aspects to help them be whole and well as complete individuals in, working towards ending the epidemic, kind of one person at a time.
And part of our vision is upholding partnerships that we have in the community. We try to partner up with the local health departments to meet, like I said before, to meet people where they're at. Especially during time of COVID, a lot of people shied away from testing because they did not want to be exposed to COVID. So in response to that, we came up with home testing. So people now have the option to test at home at their convenience. People can also order PrEP through our partnership through Mr., which is an online service that anybody can sign up for PrEP and they can start their regimen that way. We are working with other organizations just to promote sexual wellness and just to let people know that we are here for them and we're here to answer questions and provide support for them.
And one thing I want to add as well is what I'm also proud of is with CARES is that it's like a big family. So once you get tested, if someone tests positive, they can immediately meet Roger or someone that's the EIS that can, get them right into a doctor's appointment as soon as we can. And if they need any kind of case management, we have case managers right there that the EIS can hand off to the case manager. If they really don't want a lot of help, but still want a little bit of support, they can, go to Nick as like non-medical case management. And of course, Pat over housing, if there's issues with housing, they're able to really take just have a whole plethora of services that they can access, including tobacco. That was another way of addressing the whole health of the people that we serve.
Well, thank you. I think we've guided our conversation quite literally across the entire span of CARES, and I'm glad to get into the nitty-gritty of what CARES does and provides for the community. So, Jose, I know you could speak specifically on what services do you provide in terms of preventing HIV, and if the case managers want to speak on treating HIV, that would be great too.
Sure thing. So I'll just walk you through how a test would be provided at CARES. People have the option to schedule their own appointments online. Just go to our website, caresSWM.org/schedule. People have the option to schedule their appointments. They have the option to order condoms and lube anywhere in the state of Michigan. You can get it for free. We ship it out. People have the option of ordering home tests where they can get it for free as well. We call them, do a quick risk assessment, and that would qualify them that would show us what they qualify for as far as testing. When people come and get tested, we try to educate on the transmission of HIV, how we can prevent it with using condoms, just by having specific conversations with partners and being open about sex. I tell people that it's good to have conversations. It's good to know who you're having sex with. And that's what we focus on as far as when people come and get tested. We're not here to judge people. We're just here to provide a service. And that's what we're happy to do.
So when we think about getting folks into care, so when we talk about into care, we mean they're seeing an HIV specialist, they're getting their lab work done so we can see what's happening with their viral load, and then they're also taking medication. What we know is folks working in the world of HIV services is that the quicker someone gets connected to care from the time they get a positive HIV diagnosis, the more likely they are to remain in care throughout their entire lifetime. And so when Beth was talking about if we get someone who comes in and they do have a reactive or a positive test, we can meet with them that very same day to get them engaged in services. One of the primary things that we provide as case managers is adherence counseling. So what we know about the HIV virus is that taking your medication daily as prescribed is the quickest way to, eliminate that viral load to undetectable and prevent you from transmitting the virus to anyone else. And so that's a primary focus that we stick to for case management services.
And within housing, part of our housing dollars come from HUD, the HOPWA grant, which is a housing opportunity for people with AIDS. We know that making sure that people are stably housed is leading them to better health outcomes. And so our housing department works really hard to make sure that we're able to get people into where they need to be, have good goals that will move them along, and eventually they'll transition off and be able to take on the responsibility themselves.
Yeah, I think that's a good segue to, if a client is managing their HIV care, then at that point they may come to be a non-medical client, and that's the clients that I work with. And generally the services that I would provide would just be accessing health and dental insurance, getting medical bills paid, as well as their insurance premiums if they qualify, and accessing other community resources.
Well, that is a comprehensive look from prevention to treatment to retention about what an individual can expect at CARES. And that's a really exciting thing for people who may not know about your organization. So I'm super excited that you've explained it and explained it thoroughly and jointly as a team. So that just tells me, Beth, like you said, CARES is a family, and it does feel like you guys have integrated your responses and have really made an effort to reach out to the community. Now, CARES can't do it all, right? We are working as non-governmental, community-based organizations. So if you guys could go around and tell me what type of referral services do CARE do throughout a year for people affected or living with HIV?
Well,
One of the primary services we provide, we actually have a licensed professional counselor on staff who provides mental health counseling. She also serves as a great referral source in helping get people connect with mental health services that are more comprehensive than just counseling.
and oftentimes in the clinic, we have clients that need to address other issues that are health related, but maybe not related to their HIV status. So oftentimes we'll refer them to primary care providers in the area, pending their insurance and how that works with providers in their area.
And in housing, we often are referring them to SARA, most recently SARA, which was the COVID relief funding that the federal government provided. And so people were able to have large amounts of their rent caught up for them when they had problems paying it due to their COVID. And then we also have the American Relief Plan, where we've gotten dollars. Those are also federal dollars that are COVID related. So we have several different pots or pools of money that we're able to draw from.
At one time with the HOH program, we were offering blood pressure cuffs, water bottles. We had referrals that they would, we would make sure that we knew what blood pressure medicines they were on, their BMIs, so they could be aware of it, but still having a healthy choice for them if they decided to go on with the program with the nutrition classes. And Love does the smoking cessation group, but I know that they also had plenty of services to help people that wanted to quit without a judgmental attack on people, but it's just there. They just have services. The case management will usually tell them what we offer. Like some of those healthy relationship groups was really a challenge with COVID, because a lot of them did not know how to access their phone to, get on Zoom. So it's been a challenge with us, but it really has been something to keep them still connected because of so many things that are going on out there.
Another thing we focus on is giving good referrals to people, giving referrals to doctors that will prescribe PrEP and that are informed about PrEP, that are informed about LGBT health and what is what the issues come up with in that regard. Because sometimes we still see in the area where we will make the referral and they don't know what PrEP is, or what the specific health issues that affect the LGBTQ community. And we want to make accurate referrals to those doctors that will that have that cultural competency and people will feel comfortable going to. We also are partnered up with the LGBT organizations in the area. The Out Center here in Kalamazoo, Out Front, I mixed those up. The Out Center in Benton Harbor and Out Front here in Kalamazoo. We have Branch County Pride in Coldwater. All those places provide services for LGBTQ people to feel comfortable and if you have a safe space to talk to people who can provide services as well.
And I'm just going to jump in here real quick, because when he was talking about the LGBT community, but also so many other in the Black community, we know that there's still so much stigma surrounded by HIV. So it's been times that we get out and outreach to pastors. Some of the doctors still need education when it comes to dealing with our trans population, that just don't really know how to navigate their way through it. And sometimes they just need some education about that. So we are aware that there's a lot of stigma out there, and we really do try to support the people that we work with, even if we have to engage, really with the doctors. So, yeah.
Well, I appreciate everyone's responses there. And it has been a difficult time. I'll acknowledge, the difficulties of COVID within a lot of non-governmental organizations and CBO's commitment to ending the HIV epidemic. But it seems as if the resilience of CARES goes above and beyond to providing services for those in the community, going beyond HIV, tackling stigma, which is a big social issue, and also tackling the nitty-gritty of adherence for people living with HIV. And that is a wonderful thing to highlight about an organization, just that continuum of care and engagement within the community. And we're excited to spotlight CARES as an organization here at the Michigan HIV/AIDS Council. And so the informational interview may be done, but that's okay, because you can check out more information on this YouTube video and our social media, how to contact CARES, how to get in touch with them, because they are a wonderful organization. So thank you so much, everyone, for joining us today. It's been an exciting and riveting conversation about what CARES does for their community. So thank you all so much. And signing off here on the Michigan HIV/AIDS Council YouTube channel. Bye now.